Test 1, Chapter 6 and 12. 1. Prions are transmitted via infected food. 2. A person with a positive TB test but no TB symptoms is infected. 3. What is an early sign of malignancy? Indigestion and difficulty swallowing. 4. A vector is an animal or insect. Test 2, Chapter 38 and 39. 1. What stage is a pressure ulcer characterized by beefy redness? Stage 2. 2. A patient has a deep tissue pressure ulcer. What stage is it? Stage 3. 3. How do patients using a spirometer suspend the ball? By inhaling. 4. How does esophageal speech work? Air regurgitation, redirect air. 5. When collecting a sputum culture, make sure the outside of container doesn't get contaminated. 6. Tracheal some meat, adapter. 7. When performing wound care, take standard precautions. 8. What would a dietitian recommend for a patient with a pressure ulcer? Vitamin A, C, zinc, Juven. 9. What is orthopedic position? Upright and leaning forward. 10. Kaposi sarcoma is transmitted only through direct contact? False, indirect and direct. 11. Patients with COPD, exchange of gas. 12. Macules, flat, discolored spots, as in measles, figure 38-3. Nodules, small, not like protrusions, small masses of tissue. Papules, small, solid, raised spots, as in chickenpox. Pustules, raised spots filled with pus, as in acne. Vesicles, raised spots filled with watery fluid, such as a blister. Wheals, large, raised, irregular areas frequently associated with itching, as in hives. Excoriations, portions of the skin that appear scraped or scratched away. Crusts, areas of dried body secretions, such as scabs. 13. Esophageal speech. The patient learns to swallow air and then bring it back up through the esophagus into the mouth. Here the air is formed by the teeth and tongue into words, as it would be if it were being exhaled from the lungs. Esophageal speech is difficult to learn, but motivated patients can succeed. Electronic speech. Patients who cannot use esophageal speech may be able to use an electronic artificial larynx to create speech. Some patients may use a combination of both techniques. Test 3, Chapter 40 and 41. 1. Hip replacement. Instruct patients to keep leg abducted as much as possible. 2. Patients after hip surgery are at high risk of heel ulcers. 3. Treatment for CHF includes sodium and fluid restrictions. 4. Most common place of contractures in children, humerus. Test 4, Chapter 42 and 43. 1. After spinal tap, patient lies flat for 8 hours. 2. Hypoglycemic patient, nervous. 3. Why is foot care important in patients with diabetes? Because wounds take long to heal. 4. For a patient with a head injury, it is important to prevent pressure ulcers and contractures. 5. Symptom of post-polio, weakness and fatigue. 6. Overall care for a patient with a stroke, prevent complications of immobility. Test 5, Chapter 44 and 45. 1. Leg bag on male should be placed greater than inner calf or thigh. 2. What is a stoma? 3. When should you remove a drainage bag? Greater than whenever it is full. 4. Where should you instruct patient to dispose of toilet tissue after they are done using bedpan? In a plastic bag. 5. When collecting a sample, use standard precautions. 6. What is a symptom of cystitis? Frequent urination. 7. Symptom of GI malignancy? Constipation. 8. When administering an enema, use standard precautions. 9. An enema should be inserted 2 to 4 inches. 10. The temperature for an enema solution should be 105 degrees F. 11. Drainage bag should be attached to frame of the wheelchair. 12. Drainage bag should be attached to frame of the bed. 13. Urine specimen should be taken immediately to the lab. 14. Specimen should be placed in a plastic bag with biohazard label. 15. A catheter in a female should be attached to always to inner thigh. 16. Intermittent catheter immediately removed. 17. Jejuinosum meat for enteral feeding. 18. Nephritis causes hypertension and edema. 19. For a patient with nephritis, it is important to take accurate I&O. 20. What is not an aging change of urinary system? Kidney function decreases at rest. 21. Protoscopy, view rectum. 22. Renal calculi, kidney stone. 23. Cholecystitis, inflammation of the gallbladder. 24. How can you stop the spread of C. difficile? Hand washing.